Hi, welcome once again to this program, Joy in Our Town. I am your host, Meli de Leon, and I am so happy that you are watching us today. I encourage you to stay tuned. There's a lot of information that we want to share with you. It's important information here for us here in the Valley. Did you know, and obviously a lot of you may know, that insurance is very expensive in today's day and time. A lot of people can't afford it, and a lot of people don't get the help that they need, the medical attention that they need. But there are medical free clinics that we offer here in the Valley, and we are going to talk to you about that right now. We have with us Mr. Bill Reagan. He is from Loaves and Fishes in Harlingen, Texas.
That's right.
And he is here to talk to us a little bit about different clinics that they offer here in the Valley. Welcome to our program, Bill.
Well, thank you for inviting me.
Yes, thank you for coming. And can you tell us a little bit, tell our audience a little bit about what is Loaves and Fishes?
Loaves and Fishes is an organization that is actually owned by the churches in Harlingen. Our motto is to give help and hope to the hungry, the homeless, and the hurting. And we've been in business now for 26 years. We have a soup kitchen, a homeless shelter, and also we have a clinic that we operate for people in our community.
Awesome, awesome. So the clinic, you're talking about a health clinic, and it's free?
That's correct. Yeah.
Okay. Now, is that only for homeless people, or is that for general public? Or?
It's really for everybody in the community who might need to see a doctor.
Okay. Now, are those clinics offered on a monthly basis, or is it something that's ongoing throughout the year?
Well, there are two things that we do, as a matter of fact, at Loaves and Fishes with regard to our clinic. One is we have a nurse on our staff who is there Monday through Friday and is able to see patients and help folks with whatever emergency medical needs there might be. She goes into our dining hall regularly and offers blood pressure and blood sugar checks and that sort of thing. Also does educational activities in our dining hall with our clients. And we have a collaboration with Culture of Life Ministries through our department, Great Physician Healthy Living, in which a physician comes to our building 3 days a week and operates a doctor's office just like any other doctor's office. The only difference is they operate only on donations. Wow,
wow. So how did the free clinics start here in the Valley?
Well, it was the vision, I think, of our friend Dr. Steve Robinson, who is a physician and has, as a result of his very deep faith and his great love for Jesus, wanted to serve the population in a way that would catch those folks who fall through the cracks. And so he started Culture of Life Ministries a number of years ago. It might be 3 or 4 years ago now. We really got off the ground with it about 1.5 years, maybe 2 years ago, in which he was able to start working full time, and we were able to bring him into our building on a regular basis. And so Dr. Robinson operates the clinic. He has a number of physicians who help him, and nurses and other healthcare providers who volunteer their time.
Well, and that's all volunteered from, and they're all professionals.
They're all professionals licensed.
So they're licensed. Wow. So what was the need that you saw here in the community?
Well, we see it all the time at Loaves and Fishes. We see folks in our shelter who have untreated dental problems, untreated diabetes, untreated obesity, untreated mental health issues and that sort of thing. And in the dining hall, we see the same kinds of things. One of the great paradoxes of our life here in poverty in the Rio Grande Valley is that we have a higher incidence of obesity and diabetes than in the rest of the country. And we also have a higher incidence of hunger than the rest of the country. So a lot of hungry people are also sick because of problems with diabetes and obesity. We wanted to start addressing that, and Dr. Robinson came along and offered us the opportunity and chance to partner with him and his staff to address those issues.
Wow. Do you have an idea, more or less, how many people go to your clinics and go get assistance?
Oh, yeah. Dr. Robinson sees about 300 patients a month.
Wow.
And our nurse sees about 400 patients.
Now, do those patients continue coming back?
Many do come back, yes. But
is there a point where you tell them, okay, you need to get your own doctor, we can no longer offer this as a free service, or
we don't turn anybody
you don't
away.
turn them down?
Yeah.
That's amazing. That's an amazing thing that Loaves and Fishes is doing. I didn't realize you had that part of
Yeah.
into the program,
We-
incorporate it.
For all of our services, it's always no questions asked, and we
That
just
is
don't turn anybody
awesome.
away.
That is
Yeah.
awesome. Now, who can get the help? You were mentioning that.
And really, anybody who comes and signs up and gets in line can.
Wow.
We find basically two kinds of people who come in. One is a person who really has fallen through the cracks. They haven't been able to get Medicaid or Medicare, or they haven't signed up for the Affordable Care Act, or whatever the reason may be. And those are the folks who are our primary target. But we also see a number of people who maybe do have health insurance, but deductibles are pretty high for many people
They
today.
are. They are.
$5,000, $10,000 deductibles, and co-payments for many people
crazy.
are $45, $50, and for poor people, putting together $45 and $50 at one time to be able to go see a doctor is kind of difficult.
It's major sometimes, yeah.
So people maybe who are suffering from an acute episode, but who do have insurance, but really can't afford even the deductible. We see a number of them as well.
Wow. Now, have you found this to be successful here in the Valley so far? I mean, you said it's fairly new,
Yeah.
but have you seen a lot of success
I think it's
with the
made
program?
an enormous difference
that's
for our
awesome.
community
Amen.
here in Harlingen, and particularly for the population that we serve.
Can I ask you, do you introduce them also to God as they go, with a physical need? Do you somehow implement? Maybe some of these people don't know God.
Yeah, all of our staff members are committed Christian people who incorporate their love for Jesus in the way they treat people. We do not make a confession for Christ as a requisite to receive our services or anything like that, or force anybody to go to a church service. We do provide a devotional literature and Bibles to everybody who comes in.
Okay.
Now, Dr. Robinson, on his clinics on Thursdays, he invites a Anglican priest who comes and does a healing service with his clients every Thursday morning at 10 o'clock. And so the clinic stops for about a half an hour while they do that service. And he also has, as part of his staff, a number of people who mingle with the clients while they're waiting to be seen, and offers to pray with them, and does indeed pray with them.
And do you see people liking that and accepting that offer? Are they open to it? How?
Amazingly open to
Really?
it. Yeah.
Well, that's awesome to hear.
I think people often think that folks who are very poor or homeless or whatever, that maybe they're not Christians. I've found just the opposite. I found that they often have much more faith, and are much more open about sharing it than people perhaps who've been more successful in life.
Well, and I think I have found in my own personal experiences that when I am sick, I pray for the sick.
Betcha, yeah.
Because I'm hurting, and there's aches and pains, or there's something I know I went through. I broke my ankle, and I was out of commission for a long time.
Yeah,
and I think I did most of my prayer was there.
Absolutely.
And I would remember others, and I'd say, Lord, if there's someone else that is struggling with the same condition or with any other condition, and that's how we. I almost believe that God allows a little bit of that in our lives so that we can remember to pray for others. The Bible tells us to pray for one another, but I'm sure many times we forget. Our life is nice, our life is good, so we forget to maybe pray for someone else. But hearing what you are saying and how these clinics are there. I mean, even for myself, when I hurt my foot, it was hard for me to. I didn't have the insurance, and it was like, okay, now how do I do it? Where do I go? It's going to cost a lot. Like you were saying, even a deductible if I had the insurance. But I didn't realize there was clinics out there that could help me. So I think it's great information that we're giving to our community and to our public, that they can see that there's help. There's always help. Many times I think we don't look for the help, or we don't know where to go, or we don't know where to find it. But I'm hoping that the people that are watching us can continue to watch us, because we're always offering them the opportunity of a program such as yourselves.
And I think it's even more important for Christian people to reflect that aspect of Jesus' ministry in their lives. Jesus is often called the great physician, and we call our department that works in that area Great Physician Healthy Living. As a matter of fact, in the New Testament, the word that means heal also means save. The word in Greek is sozo. And for the perspective of the New Testament, salvation and healing are really the same thing.
Right, right.
You remember when Jesus said to the woman who had the issue of blood, your faith has saved you, right? Or your faith has healed you. It's the same word as saved. If anybody ought to be in the healing business, it is those of us who profess our faith in Jesus Christ.
In Jesus Christ. Okay, once again to recap, you said the clinics are every week. Every single week you have the clinic is open, and it's open at the location.
It's at Loaves and Fishes Monday through Friday. We have a nurse there every day, and we have a physician who comes in 3 days a week as well.
Now the nurse is there all day.
Yeah.
You said from 8
Full
to
time.
5, pretty much full time. That's amazing.
Yeah. We were fortunate to get a grant to be able to hire her, and we're looking forward to being able to keep her through the foreseeable future as well.
That is awesome. Now, do you only help people from Cameron County, or will other people come from other places?
Anybody who shows up at our door. You know,
that is awesome. That is amazing. That is amazing. That
most of our folks are folks who come
probably
from
local.
Harlingen. We do have a contingent that gets the bus and comes down from Raymondville, and we're very happy about that. But most of our folks are from the west side of Harlingen because it's hard to get to the hospital or the emergency room from the west side. It's a long walk, and many people don't have transportation, so they take advantage of it.
Well, thank you so much for coming, Mr. Reagan. I think you've imparted a lot of information. I didn't realize how extent Loaves and Fishes, how much they help our community. So you have been listening to Mr. Bill Reagan, and he is with the Loaves and Fishes. Their address is 514 South East Street. They are in Harlingen, Texas. Their zip code is 78550. Phone is 956-423-1014, and their webpage is lfrgv.org. So, community, thank you for watching. Thank you for listening to this program. I sure hope that you were able to receive something and able to understand or know that there is help. Besides the help that we get from God, there is also local help. Thanks for watching this segment of Joy in Our Town.